Today I'm interviewing Dr. Biljana Đurić, who specializes in sports medicine. Biljana is a teaching assistant at the Department of Physiology and the Department of Sports Medicine of the Faculty of Medicine, University of Belgrade. Hello, and thank you for taking part in this project.
Hi.
First of all, can you tell us something about the importance of physical activity in overweight and obese individuals?
Okay, so good afternoon, and thank you so much for making me the opportunity to be a part of this lovely and really important project. When we are approaching those young individuals that are obese, we need to have one multidisciplinary approach. First, it's important to find out what was the psychological cause of developing this kind of syndrome, we can easily say like that, but also to approach from the nutrition side and sports medicine side. The most important thing here is to provide one healthy weight loss that is around 1 kilo per 1 week. And in order to get this weight loss, we need to make the calorie lowerness of about maybe 500 to 1000 kilocalories. If we imagine to do that only through nutrition, it's going to be a huge caloric deficit for the adolescent. And that can cause some problems with protein intakes, lean body mass. So it's important then, beside this caloric decrease, we need to introduce physical activity as a medication that is making the adolescent to lose more energy. In that case, when we combine physical activity, actually physical exercise as one organized and individually dosed physical activity, we will gain much better weight loss than when in comparison to a situation when we are using only caloric decrease. So physical activity needs to be organized, needs to be really diverse to combine dynamic and resistance training, and to have one proper time when it's organized and one dose that is specific for this adolescent.
Of course. And what is the most convenient type of physical activity when it comes to an overweight or obese adolescent?
When we discuss this physical activity, we need to approach it from different parts. So the type, but intensity and also duration. We know that American College of Sports Medicine is recommending 150 minutes of dynamic, moderate intensity physical activity for preventing these kind of chronic diseases. But once when we have adolescent that is already overweight or obese, first we need to increase this time that is spent during physical activity. And that also depends if the adolescent was active before it or completely inactive in sedentary lifestyle. So with previously active adolescents, we will recommend around 45 to 60 minutes of physical activity, dynamic type, 5 times a week. If we have the adolescent that was inactive completely before, it should be even more than 60 minutes per day throughout 5 days in a week. So we can see that now the cumulative effect in time is almost 300 minutes in comparison to 150. On the other side, this dynamic exercise combined with caloric deficit will not gain such good weight loss as the combination of dynamic and resistance exercise. But in this case, we also need to pay attention if we are having the adolescent that is obese or extremely obese. In the extremely obese, so those are that has body mass index even over 30, we will recommend the physical activities in water, because in that case their joints are not they are not under such a big load under such a big load.
Mm-hmm.
So the injuries won't happen so easily, and they can combine swimming, aqua jogging, and after that, when they lose some weight, they can go through other trainings. Resistance trainings should be organized 2 to 3 times per week, and we need always to have like the pause of 48 hours between each resistance training, and after each training, dynamic or resistance, we always recommend flexibility exercise, stretching, in order to prevent injuries in this population.
Of course, yes, yes. And would you recommend any physical activity to individuals who suffer from an eating disorder, such as anorexia nervosa, bulimia nervosa, binge eating disorder, etc.? And what would be the best choice in that case?
Studies are really in small number in this area of recommendation, because mostly doctors are finding physical activity in these groups really uh, con- uh, well, um, confusing. They really don't know what to prescribe to this patient, and we need to point out that approach to patients with anorexia nervosa and bulimia is completely different, because in a bulimic patient we can have almost physiological body composition. They have over eating session that are followed by vomiting or excessive physical activity, but mostly they have some lean body mass. So in this group it's important to break this pathological pattern of exercising if there is one. So it's important to first find if there is any contraindication for exercising. After that, to find out what is this pathological pattern of exercising in this patient, because mostly there is one. Then to try psychologically to explain what is the adequate exercise for them, and then to go regarding the recommendation of a 150 dynamic follow with 2 to 3 resistance training in bulimic patients. Of course, always following that the food intake is adequate, so that they are gaining a sufficient amount of carbon dioxide and carbohydrates, and the proteins. In patients with anorexia, we really need to be very careful. So they have a huge deficit in lean body mass in the muscles. Also, first we need to follow the instructions and never to start with physical activity if there is any contraindication for that, because sometimes they also have the cardiovascular issues. Once we go throughout all those contraindications, we can start with explaining the adequate training for them in the beginning, and and to try to follow this training pattern. But in patients that are suffering from anorexia nervosa, we really need to be very careful, because these patients have huge deficit in lean body mass, in muscle mass. They have a lot of contraindication for exercising, because sometimes there are some cardiovascular diseases. So it's important first to go through all those contraindications, and once when there is no any, we can start with explaining what is the adequate training for them, and then to start with really low intensity exercising. So those should be only stretching exercises, or maybe walking in a really slow pace for a few hundred meters per day. So that is the beginning. How they are approaching the goals in their eating disorder therapy, we can increase the intensity and duration of this dynamic exercise, and then slowly get some exercises that are in this resistance domain. First, we should start with isometric exercises, and then once when they gain sufficient amount of muscle tissue, they can go and exercise with some external weight, and that is the plan that they should follow.
Okay, and generally speaking, how do you motivate young patients to be physically active? Are there any tricks?
Yeah, the tricks are to first find out what is the activity they like. So if you try to make adolescent do something that they don't want, it's complete disaster. So trying to find out if they like jogging in the group, if they like maybe exercising in the gym. So we can always organize the group memberships in the gym, so they can exercise with their friends. So then as a group they are going to be motivated to do that. Or we can encourage them to try to use walking or cycling to go to the school, to come back from the school, or to simply organize some family activities. So to give an example, like let's go in hike tour. So simply to try to make this group effect, and then they will get into this exercising much easier. Also, we can encourage them to try to gain some new motor skills, like start maybe roller skating, or maybe in the winter they want to learn how to ski. So the new sport will be interesting for them, because most of the studies are giving information that they get bored really easily from from one type of exercising. So it's okay to switch from one sport to other, from one club to another. Until there is no any contraindication for exercising, but mostly this group phenomenon and exercising with their friends, with their the group that they are, for instance, going to school with, is something that will motivate them mostly to exercise.
And you mentioned family activities. Okay, how do you, as a sports medicine specialist, approach parents? What is their role in treating and, first of all, preventing obesity and eating disorders in children, adolescents?
In this case, it can be really tricky with parents. So they sometimes can judge their children because they are obese, they have eating disorder. They sometimes think that it's the way they are acting out. They don't see it as a health problem. So first, parents need to be aware that this is a health problem and that it's needed to be treated with a group of doctors, and to try to make a support to their children. They need to talk to their children to find out what is maybe the reason that provoked this overeating, anorexia, or this completely sedentary lifestyle that led to obesity. Of course, they need to provide throughout the entire childhood the positive example for their child. So they cannot say, okay, why are you not exercising, and they are spending the entire day on the computer or the phone. They need to try to incorporate physical activity in their everyday way, to go to work with the bike, to go walking everywhere they can. So if they make this example for their child, the child will take this pattern and its own
adopt
lifestyle.
the pattern.
Yes. So that is something that they can do throughout the childhood. But once when the problem is there, the psychological support is really important. So they need to encourage their child to get the healthier life habits. They can maybe prepare meals together, and to go and have some physical activities that are prescribed by a doctor together, so they can follow how the child is changing in this period, and be like physical and psychological support in the process.
Of course. And finally, you've already mentioned 150 minutes of moderate physical activity per week as a sort of standard, and this amount of time has been stated in the National Clinical Practice guideline, actually, for treating obesity, that was published in Serbia in 2022 as a sort of gold standard. How do you adapt this particular amount of time to the adolescent population?
Well, it's a really nice question. We got it really often from our students. So how to get this 150 minutes through the week? And one of the answers that I always give to them, okay, are you coming by bus to faculty? First, take one station before faculty. Then, okay, take two stations before faculty. Then you can, now in the summer organize, after the studying, you can go all together and make a pause in the swimming pool. Go in the morning, swim a little bit, then come back. Every minute will count. It's important because actually they're mostly healthy, because this can be in this is recommendation for preventing the obesity. So they can organize the session of half an hour. So that is basically 5 days, 30 minutes, and every minute counts. Go walk to the store and back. Go maybe jog in the evening after you finish with your studying, or go in the morning with your friends and swim a little bit. So swimming of the half an hour is everything that you need to do throughout the day. So find the activity that's interesting, find a group, because it's always easier to perform it in the group, and simply collect it every single minute. You can follow it through some device. I mean, the kids really today have a lot of smartwatches, phones, so you can follow each minute of your activity throughout those devices. And once when you collect it for a week, treat yourself with something. It's going to make you to do that even the next week.
Of course. Biljana, thank you very much once again for explaining this to us and for taking part in this project.
Well, thank you for those lovely questions. It was really interesting to participate.
It was a pleasure too. Thank you.